buenos días, good afternoon to those of you on the East Coast. My name is Adrián Pedrosa. I'm the Executive Director of Abriendo Puertas Opening Doors. We're very excited to kick off our advocacy webinar series with this webinar today on the federal budget and where things stand. This webinar will really give us some insights as to where the federal budget stands now and how it impacts families and children. By the end of the webinar, we'll gain a better understanding of the federal budget process and how we as a community can influence the process to benefit child and whole family well-being. At Abriendo Puertas Opening Doors, we work with a network of partners across 43 states to invest with them in parents and caregivers as leaders and to honor them as their child's first teachers and advocates. Every day, our partners engage with thousands of families and gain a deep understanding of the needs, hopes, and dreams that they experience as they work to be the best parents possible. Many time, our partners, communities, and families are unaware of how the federal budget process impacts their daily lives. Everything from childcare to Head Start funding to WIC, SNAP benefits, Social Security, Medicare, just to name a few things. We typically only hear, in the news headlines about government shutdowns and sort of the crisis many times, like what we're facing now as there's a stalemate in Congress. But today we're going to learn about how we can come together to continue learning about the budget process and how we might also get involved as we all realize and see that the budget process is very much connected to the opportunities that we might see in our communities. We have assembled a great panel of experts here today. And just want to thank the Abriendo Puertas team, all our partners, all of you for joining us, for being a part of this network that really centers family and community voice around civic action, right? And our focus, as we know, is to really look at how we can further support, build healthier environments for families with our youngest children from prenatal to 5 years old. So I'm going to go ahead and introduce our panelists. We have three panelists joining us here today. Joel Friedman, who is a Senior Vice President for Federal Fiscal Policy at the Center on Budget and Policy Priorities. There he specializes in U.S. federal budget and tax issues. He's a Senior Fellow at the International Budget Partnership, where he focuses on budget transparency and accountability in countries and around the world. Thank you for joining us, Joel. We also have Amber Wallen, who has been with New Mexico Voices since over the last decade. She was brought on as the Center on Budget and Policy Priorities Fiscal Policy Fellow, and later served as a research and policy analyst, and also the director of the New Mexico Voices Kids Count program. Before becoming the executive director last year, she was the deputy director at New Mexico Voices. Amber is a state and nationally recognized expert on issues related to child and family well-being and fiscal policy. Thank you for joining us, Amber. And I think she's will be joining us a little bit later, so we'll be able to hear from her. And then we have an incredible parent leader who we've had the privilege and honor of getting to know over this last year, Elizabeth Nicasio. She's with the Gads Hill Learning Center. She's the mother of two children, raising them in Chicago, Illinois. In July, Elizabeth helped us launch the Latino Infant Initiative at the Unidos US Conference in Chicago. And so we're fortunate to have her here with us today to talk about the impacts of the budgets as it relates to what she sees in her communities and as a mother there in Chicago. Thank you, Elizabeth.
Thank you.
So with that, I'm going to go ahead and kick it off to our first panelist, Mr. Friedman. Joel, if the floor is yours.
Thanks so much. I really appreciate the opportunity to be here and to present on the state of play of the federal budget. Let me share my screen. I hope that's working okay. And so for my plan here is to go through three issue areas that we think are likely to happen this year related to the federal budget. there's the annual appropriations. These are programs that need funding each year. The federal fiscal year starts on October 1st, so there's an imminent deadline to this work. As I'll discuss a little bit more, there is a whole wide range of programs that are covered through this appropriations process. Sometimes these are known as discretionary programs in federal budget speak. The other big piece of legislation that we anticipate may move this year is the Farm Bill, and importantly, that includes a reauthorization of the SNAP program, formerly known as food stamps. The Farm Bill gets reauthorized every 5 years, and this is the period when it's up. And then finally, there may be a tax package at the end of the year, and we see that as an opportunity potentially to do an expansion of the child tax credit. Before I get into the details, it's important to note for both the appropriations and the Farm Bill, I feel like we're playing what I would call defense, which is that we're really trying to make sure that bad things don't happen, that there's a lot of pressures in that area that are looking to cut programs that we think are important for families and kids. So we need to push back against that. For the tax package, there's an opportunity probably potentially to make some progress on the child tax credit. So in that sense, we'd be playing some offense. But first, before I do anything, I want to give you a little crash course in the federal budget. As you can see, the federal budget this year, it's projected to spend over $6 trillion. And the programs that are shaded in blue, the little pie slices that are in blue, those are programs that are called mandatory or entitlement programs because they're permanently funded in the law. So they don't need annual funding the way appropriations do. And these are familiar programs: Social Security, Medicare, Medicaid, Affordable Care Act, subsidies. In fact, those retirement and health programs alone take up about 45% of the federal budget. And then there's a slew of other mandatory programs, and that includes programs like the SNAP program we were talking about before. It also includes things like federal retirement, military pensions, veterans pensions, a host of smaller programs. It also includes actually the refundable tax credit. So the child tax credit, part of the child tax credit shows up there under government accounting. The yellow slices is what's labeled as defense and non-defense discretionary on this chart is reflects the annually appropriated programs. These are programs where every year they have to get funding in order to operate, and they make up about a quarter of the budget. So a smaller chunk. And defense, it's basically the Defense Department. Non-defense covers, as I'll explain in a second, a very wide range of programs. And then last, of course, there's net interest, which is the interest that's the interest payments that have to be made on the national debt. So to drill in a little bit more deeply now on non-defense discretionary spending, and this is the subject of the appropriations bills that we're following very closely and that are going to be where the fiscal year starts now on October 1st. You can see it covers really just such a wide range of issues. Starting up in the upper right-hand corner, a big chunk is for transportation-related programs, so highway programs, airport, air traffic control, things like that. There's a big chunk is from veterans health care. There's some veterans programs that I mentioned before that are on the mandatory side where there's permanent funding, but the health care has to be funded annually. There's education programs, so mostly K through 12, so Title I, but also Head Start is part of that group. The health chunk in non-defense discretionary is not, it's not Medicare and Medicaid, because those are part of the mandatory, the permanently funded entitlement programs. This is more public health type issues, things like the Center for Disease Control, Indian Health Services issues, programs like that are funded in there. And then in the economic security slice, we'll have programs like the housing rental assistance is a big part of that. The WIC program for mothers and infants all get funded as part of that, and so on. You can see there's the environmental and science programs and law enforcement, and then even diplomacy. So it's really everything that people think of as government is funded through this annual appropriations process. Yet, if you remember the other pie, it's really a fairly narrow slice of the federal government. One last thing to know about these programs is that the funding for them has been very tight, these non-defense programs, over the last decade or so. There's been constraints on them that have been in place since about 2011, and virtually every funding area has been reduced. Still below the 2010 level after you take into account growth in the size of the population and inflation. The only area that's really seen growth has been veterans healthcare, which grows like all healthcare grows faster than inflation, and there's been a lot of demands on that, and so that's been the one area that's been funded adequately. Others have really continued to struggle in the funding area. So what's the outlook now for this year for appropriations? So you may have heard earlier in the year in June there was a threat of default on the national debt. We had reached the debt ceiling, and an agreement was made to avoid that calamity. And as part of that agreement, levels were set on appropriations for defense and non-defense. So the process really began at that point. And both the House and the Senate appropriations committees have been working. Fortunately, the Senate has largely been following along with the agreement that was set. The House, however, has been going below the levels in the agreement, and in addition, they've been including policies known as riders that have really quite controversial on issues related to racial equity, abortion, LGBTQ rights. So a lot of these very hot button issues that are not normally part of appropriations bills, they've been using as an opportunity to do that. So the Senate bills have been largely bipartisan. In the House, however, they've been really strictly partisan. So it's just been the Republicans in the House who have been driving those bills. So we're at a point where the two houses are moving in very different directions, and yet we have this imminent deadline of October 1st when funding needs to be provided. Normally, Congress would do a routine, what's called a continuing resolution, just to give more time for them to negotiate out the differences between them and come to a resolution. But the path to a continuing resolution is not at all clear at this point. And there's real fears that there'll be a shutdown of the government, that some operations that are funded through appropriations will be curtailed during that period. And of course, it'll be very complicated to get ultimate resolution by the end of the year on these bills. It's important to recognize in the process this year that even if they stick with the deal that was reached around the debt limit, it still means that the funding levels are very tight for important programs. Overall, basically, the non-defense category is being held to a freeze at last year's levels. So we're very concerned, for instance, about the WIC program, which has seen growth both by increased participation and higher food prices. And so that means that it's going to need a several $100 million increase just to keep pace with demand and not turn any mothers or children away. And it's a program that's had 25 years of bipartisan support to fully fund it. And so we're hoping that will continue through, but it's a program that's under threat because of these tight funding limits and all the controversy being kicked up by the House bills and the cuts there. Similarly, the housing programs are because housing prices have been and rental prices have been increasing. That's another area that's going to need an increase. So again, for these programs to get the increases to continue to fund and meet basic needs, other programs will have to be cut back. So it's a difficult environment in appropriations, and it's important in this area to flag these areas that need full funding. So the other area I mentioned that's going to be on tap this year is the Farm Bill. But both the House and Senate agriculture committees have talked about addressing this fall. Our focus here, I think, is the SNAP program, a terrific program that helps 40 million people every month put food on the table. And about 2/3 of those recipients are children. A big controversy around the SNAP program has been around work requirements. And already in the debt limit bill, we've seen those work requirements have been expanded as part of that bill. And that's contrary to what we know and what the research has shown, that these work requirements really do little to increase worker earnings, but they do increase hardship when they end up denying people benefits. And that what we know based on the data are that most SNAP participants who can work do work. So it's going to be very important to push for to protect SNAP during this process. I think Republicans have been pushing for cuts, but Democrats, particularly in the Senate, have been very firm that they and in the Senate you need 60 votes in order to pass a bill, and so to get the Farm Bill across, they've said that no cuts in SNAP they wouldn't support a bill that has cuts in SNAP. So I think supporting that position is going to be very important moving forward. Finally, let me just mention the year-end tax package. There's a lot of interest in restoring some corporate tax breaks that have recently lapsed. But again, there's a lot of pressure, particularly from Democrats, to ensure that any year-end tax package also includes, if it's going to include something for businesses and corporations, it has to include something for families and children. And the focus is on the child tax credit, which is a good credit, but not very well designed, particularly for low-income families. Because of the design, under current law, about 19 million children are in families with incomes that are too low to receive the full credit. I mean, really, the design of the credit, as you can see from this graph, is sort of upside down, that the families that need it the most that are the ones who don't get the full credit because of the way the benefit phases in. But if you're a high earner, you're getting the full amount. So I think that the hope is to get the child tax credit and a good expansion of that to get more of the credit available to low-income families. Let me close just by noting that the poverty figures came out yesterday. You may have heard, and child poverty really it jumped dramatically between 2001 and 2002, in large part because or entirely because of these pandemic relief programs that were provided in 2001 had expired. And a big part of that was the child tax credit. And we estimated that of the 9 million children that were in poverty in 2022, if the expansion of the child tax credit that had been in place in 2021 were still in place, 3 million of those would have been protected from poverty. So that's why it's so important to continue to push for an expansion of the child tax credit, hopefully later this year. So with that, I will turn it over to.
Thank you, Joel. Thanks for that great summary and really helping us to understand that connection between what's happening at the federal level to how it impacts families and children's lives on an everyday basis. As I introduced you earlier, Amber, we're fortunate to have you with us. You are on the ground here in New Mexico as a budget and policy expert. You understand, you study this, you analyze it. What's happening at the federal level, and very importantly, right, you understand how, as the federal budget is worked out, how it impacts states, right? And we have a wide network of participants on this webinar from across different states. You're on the ground in New Mexico. So please, going to hand it over to you, and love to and interested to hear your perspective on how things are going to be impacted at the state level.
Yeah, thanks so much, Adrian. Can you hear me okay? Yeah? Okay, great. It's great to be here with you all, and good to see you again, Elizabeth and everybody. I'm going to share a little bit. And before I do, also just thanks to Joel. You know, the Center on Budget is a great partner to New Mexico Voices for Children as well, and has long been, you know, just invested in work all around the country as we think about how we can better structure budgets to support kids and families. And so I thought it might be helpful. What I'm going to start with, I'm going to share some slides here. And feel free to let me know if there's any trouble seeing that. Can you see that? Okay, Elizabeth, can you give me a thumbs up?
We can see it.
Okay, great. So, you know, given, I think with all you folks on the call, you know, and I have known Adrian and Javier for a long time, and I think what brings us all to this work is our common drive to center kids and families and communities in public policy. And how do we do that well? And at Voices, you know, that's what drives us. Our mission really is truly to help pass great public policy that improves well-being for New Mexico's kids and our families and our communities. And Adrian mentioned, but a big part of the work that we do is tax and budget work. And I think sometimes folks might think, well, why does a child advocacy organization focus so much on tax policy and on budget policy? But I want to start with that because I think it's the reason we're all here together today, is because that is such an important area. If we're focused on kids, then we should be talking about taxes. We should be talking about budgets. And so the reason we got into this work was about 25 years ago, and we were advocating in Santa Fe for great policy, research-based. We had all the data, and what we would hear in Santa Fe, which is where New Mexico state capital is that, you know, we love kids, we love families, teachers, yes, schools, but we just don't have the money to fund those programs. And so we got into the business of doing research and understanding how we can ensure that the state budget has adequate revenue to fund all the programs that matter most for kids and for families. And so we do that work with that approach of trying to make sure the state has enough revenue. And then we also focus on fairness in the budget and in the tax system, and on racial and gender equity in the tax system, and thinking about who is contributing, who is paying, and who is most seeing those benefits. And I'm following Joel, and so he talked about the federal budget. And I'm not going to talk much about New Mexico's state budget because all state budgets are different. They're all unique in their own ways. But one of the things that I wanted to share is, you see it in the background. What I've included is a snapshot, which don't worry about trying to read this. But this is a snapshot that we made of how the New Mexico state budget is made. And I'll say that even though this is a simplified breakdown of one state budget, I want to just name and say out loud that it can be really overwhelming and really intimidating to hear about, and to work to understand, and to feel like you have a place in advocating within budgets that are complicated, whether they're at the federal level or the state level or the local level. And I also want to name that that's not necessarily accidental, right? Because budgets and fiscal policy processes are too often not built or not necessarily intended or to deliberately be inaccessible to the people that they impact the most. And while that's changing in a lot of places, I think it's really changing in New Mexico, and we're a leader in this area. But it's really incredibly important that community members and residents and families and workers can access that knowledge and participate in how budgets are made, because your voice needs to be heard. You can have a voice in the budget process and how much money is raised and how it's spent, because budgets have such a big impact on all of our communities. And this right here, you saw a pie chart of the federal budget. This is a New Mexico budget for our current fiscal year. And it shows kind of just really big picture what we're prioritizing most and what we spend. That biggest chunk is education. We have big chunks for healthcare, for public safety. And those are all really important. And why, we're talking about this today, because obviously it's so important to see and have a voice in, because budgets impact every area of our lives, even though sometimes they can feel abstract and further away. They're just obviously touch everything that we do. And so while some of those charts and graphics and decision flows can get complicated, what we're really talking about in all of, in everything today and in everything about the budget is all these services and programs that touch our families and our communities. So budgets are schools, their teachers, their childcare assistants, daycare center, healthcare, their parks and museums and clean air and vibrant public spaces. And, even another level of it, I think that leads us to what I think is the real truth about what budgets really mean and what they truly are. And that's reflections of what we think are most important and what we value the most of the types of communities that we want to create and build for our families and leave behind for our kids. To put it another way, I like to include this quote. This is from President Biden, and it's, "Don't tell me what you value, show me your budget, and I'll tell you what you value." And I think that valuing is really key as we're talking about budgets. And we saw this reflection of values during the pandemic that's really showing up today is when it became, more clear than ever just how important the childcare industry was, not just to kiddos and to parents, but to all workers and all businesses and our economy in our state and the nation as a whole during the pandemic, when we saw so many folks lose childcare, so many women drop out of the workforce because they didn't have access to childcare. And, if what we saw is that if we weren't supporting childcare, then children could lose essential services, parents would lose care, mothers especially would be harmed and lose wages, businesses would lose employers, and the whole thing could collapse. And so what Javier had asked me to talk about was a bit about how the federal government relief through the American Rescue Plan and through other programs really had a big impact on childcare that is now threatened. And so you can see there, and there's a lot of numbers here, but you all get these slides, but the big things are circled. The Child Care Stabilization Program passed through the American Rescue Plan in 2021, allocated $24 billion in funding to more than 220,000 childcare providers across the country, and that covered as many as 9.6 million children's childcare across the country. And states were using that money in different ways. So here in New Mexico, we directly increased childcare worker salaries. We waived all parent copays for childcare. We significantly expanded our childcare assistance programs to cover not just all essential workers, but all families below 400% of the federal poverty level. That's about $120,000 for a family of four. And then we also directly invested money in childcare centers and in home-based providers. Now, what you heard is that federal budget changes and federal budget decreases, particularly in pandemic, early childhood relief, had big impacts on communities and stand to be a real threat to state and communities and families and kids in each of the states. And so it's estimated that 1,000 early childhood programs, daycare centers, providers could close, that 1 in 3 programs, that translates to 1 in 3 programs. And there's been some estimates that over 3 million children across the country could lose care. Now, that would also result in big economic losses, most from lost wages for families, that would add a lot of financial strain to families, to communities already struggling with a lack of childcare, and particularly a lack of affordable childcare. And something else that we know, this is I include this because it's an interesting survey of what providers would do if they lost funding. And what we know and what we've seen in New Mexico is that if funding to providers goes down, so if funding at the federal level goes down, then that's passed down to states, and then that would pass on to providers, and then providers would pass that on to families. Thanks, Paige. And so then that's, what we see here is that providers say that they would have to raise tuition for families, they'd have to cut wages, they'd have to lose staff, and they'd have to serve fewer kids. And so we know that this would happen at a time when child well-being is already struggling, and that kids and families are facing big challenges. And so you heard Joel talk about increasing poverty rates, and we know that that's amongst pandemic era challenges that still persist. So you can see just here in New Mexico that families this year are still really struggling. Nearly half are having a hard time paying for basic expenses. 12% aren't eating enough. Many feel like they're about to be evicted from their homes. And then that's in the context of nationwide that early childhood fees and tuition continue to rise. And we know that that's essential. Just a side note, we know that that's essential. We know that our providers, that our workers need to be paid more. We need to have continuity in care. We need to have stabilization for our workforce. And we need to have high quality care. But that means that tuition and fees are rising significantly, even nearly double the inflation rate. And the other context of that is that as all these federal changes are happening, and as all of these programs are put into threat that will loom large for families and kids, that's again among specific challenges for families, and that's really felt most among women and women of color in our states. And so you can see these are COVID area numbers, but more mothers than fathers dropped out of the workforce, lost wages, reduced their work hours, especially those with young children. The looms particularly large for women of color, particularly Hispanic women and Native American women and Black women. And then even if you drill down further, that immigrant women of color were facing the biggest challenges and have had some of the hardest times recovering from the pandemic because of immigration restrictions, because of language barriers, and because of lack of access to programs that Joel discussed that are really key for our families and for our kids. And so, another thing, maybe shifting a little bit to maybe a bit of a positive frame and what we can do about that, and some of the things that are being done, is that more recent employment numbers show that a lot of those pandemic workforce impacts on women have rebounded, and that women's labor force participation is really high right now. But what we know is that federal budget changes, particularly changes in childcare, money that flows down from the federal government to the states, to providers, to workers, to kids, to families, communities, that can really threaten those gains. And so as we think about the ways forward, we think it's really important that we continue to center racial equity and gender equity and focus on how are women of color doing, how are immigrant mothers doing, how are women of color workers doing, and that's really a signal to where we need to invest and to where we should be investing in our communities. And, some states are taking a really forward approach on this, as the federal government has debates about what will happen, as we know that many programs are at risk, and then specifically that childcare is facing what some are referring to as a funding cliff as pandemic era relief goes away. But number of states, including New Mexico, and I'll say this is an area where New Mexico is really leading the nation in how we can address some of these loss of benefits and loss of funding. So we're expanding eligibility for childcare assistance, waiving all copays for families. New Mexico and some other states are creating pay supplement programs that increase wages for early childhood educators. There's also needs to be, and is in some localities, a real focus on reducing barriers for especially home-based providers, for women who are caring for children in their home and are doing an excellent job, but sometimes that's a really difficult system to navigate. There's also a real push to increase tax credits for working families and families with children. New Mexico was one of the first states in the nation to create a state-level child tax credit when it became clear that the federal child tax credit expansions were going away. We were also one of the first states in the nation to expand a tax credit that goes to working families, specifically to immigrant families who had previously been ineligible because they're ineligible for a similar federal credit. And so a number of states are leading the way to think about how we can really center kids in public policy. And then lastly, and maybe this is the biggest, I put it at the bottom, but creating long-term funding streams for early childhood programs. Because again, all these programs cost money. All of the programs that Joel was talking about cost money. And so it's really critical that local governments, that states, and that the federal government have robust revenues that they need to support the programs that matter most for kids and families. And that's, of course, where the tax policy comes in. But the last thing I'd say is that in addition to focusing on those really strong budgets and making sure that we have enough revenue to focus on those, there's also other ways that states are boosting programs, that states are investing in families, that they should be investing in families to build opportunities to thrive. And so in New Mexico, in recent years, we've restructured a lot of our personal income tax code to benefit families, particularly families with kids. And it's really reshaped how much people pay in taxes and the benefits that they're getting out. We've also significantly improved higher education affordability, made college nearly free at most levels for New Mexico residents, expanded healthcare programs. We passed paid sick leave for all workers. We've increased education funding. In addition to our early childhood levels, we've increased it in K-12 education as well. And then you also heard Joel talk about SNAP and how critical the Farm Bill is for ensuring that families have the resources that they need to eat. What New Mexico has done additionally is pass a lot of food security relief programs, one of them being free school meals for all kids in New Mexico. So what I just end on is that the federal government is huge and the impacts are huge. And we see that trickle down in a lot of ways. And also that state budgets and local budgets have a really critical role to play in filling gaps and advancing policy where federal government may not, in setting priorities that are important for states or uniquely important to states, and that you all and people across the country and people getting engaged in it is really key, and particularly at local and state levels has tremendous power to really shape what policy is being passed, who's being prioritized in it, who can participate in that policy making. And so just again, encourage you all to get involved because there is so much power in that engagement. And we've seen it happen firsthand in New Mexico. So thank you all for having me, and happy to be here for questions now or anytime in the future.
Great. Thank you, Amber. Yes, we're going to take some questions after we hear from Elizabeth. Just want to, again, thank you. I know the participants couldn't see why we invited you to be on this panel, and we've known you for a long time in your work. And when you talk about New Mexico, just really now being looked at as a model as to how to restructure budgets, to make those big investments, to look at tax policy, it really is the work of the nonprofits like New Mexico Voices on the ground, of advocates such as yourself, through New Mexico Voices and in the community. And really connecting, right, the work that's happening at federal, state, to what you said early on, right, that importance of hearing from families, from children, and New Mexico Voices does such a great job at being part of that ecosystem that has done that work over the years in New Mexico. And it really is, it's something that I hope as our participants are hearing these presentations, that when we say families have a voice, many times we think, yeah, we kind of maybe roll our eyes and don't believe it, but the reality is, there are examples, and the story that Amber shared about New Mexico is an example that family stories, family experiences do matter, and policymakers will hear those, and these changes came about because of the stories of families, because of their involvement, them going to the Capitol and making their voices heard. Elizabeth is one of these amazing parent leaders who's at Gads Hill Center, as I said earlier, in Chicago, and she's here to share with us, a little bit about her story and her experiences in her community in Chicago, Illinois, and how budgets impact her her daily life, and her her desire and her work towards being the best mother, and to give all the opportunities like all parents want for their kids. So Elizabeth, I'll hand it over to you.
Thank you. Good afternoon. So let's say, like everybody's saying, that this does happen. This is really going to affect our center and us as parents, because we won't have the teachers come to the house to see our kids and get the help that we get. And Gads Hill has an awesome opportunities for parents as well, for activities for us to do as well there. And if this happens, then we won't be able to get them anymore, which I've been with Get Till with my kids for about 5 years already. I had my 7-year-old in there in the program. Now my 7-year-old is already in grammar school, so I have my 2-year-old in there, and that's going to be like a total loss for us, because when my son's teacher comes to the house to see him, he knows that she comes and he's excited to do the activities that she has planned for him. And if that I feel that he looks forward for her to come every day. And the good thing about our um center that we have, they let us know about any government changes that are going on. So they keep us updated as parents. We do have a parent policy committee that also informs us about everything that's going on. So it's a great program, and I would hate for it to um for the funding not to go through. Adrian?
Whoops, there we go. Thank you, Elizabeth.
Sorry, I froze. You know what? My screen froze. I'm sorry.
No, you're good. We heard you perfect.
Thank you.
So you're always so gracious. I mentioned earlier that you were in Chicago, Illinois, with us when we launched the Latino Infant Initiative policy agenda with Unidos US at their conference, and
Yeah.
you always show up and you're willing to speak and share your story as a parent leader. Can you just share with the group why why you always say yes and willing to kind of advocate and share, and what has been your experience over the years that kind of led you to this point?
I actually always love to participate, anything to do with children. I like to help and do and put my voice out there, and want my voice to be heard, because our children, we speak for our kids. Our kids are little, or they still don't know. So I feel that if us as parents, we have to make a point and say what we want and know that our kids have needs. And also, being a Latino woman also pushes me, because my parents are immigrant parents. So I want to make them proud, and for them to know that, you know what, my daughter is doing this to help for her kids, for our grandkids' education, and for their well-being. That's why I always say yes to join.
I'd love to hear that, and you are making them proud and making your kids proud.
Yes.
They're seeing you advocating, and speaking up, on your behalf and your family's
Yes.
behalf. So that's also contagious, and your kids will also be more likely to speak their voice and to advocate for themselves and their community. So
Yes, we push them to be outspoken, to talk a lot, to say what they want, and which is great that they follow our footsteps.
Very good. Well, thank you, Elizabeth. I want to ask the rest of the panelists to go ahead and come on screen. I'm gonna ask a question, and Joel, if you can kick us off with this, and would love for Amber and Elizabeth to jump in. But we hear, I mentioned earlier in the webinar that we're many times hearing the headlines in the news about the divisiveness that's happening, and you mentioned Joel, about how kind of the budget process is used to make political and kind of for even non-budget reasons, right? On to really push culture wars, or to create more divisiveness within our community. Can you talk a little bit about either how you've seen or how you feel that community can participate in a way that restores, right, more unity in the budget process, that brings us together, that helps us to really find commonality, right? A lot of things we talked about today are things that I think if you ask everyday people here in the United States, they share some common values, more common than we see divisiveness, but that's not what we always hear, and we kind of the headlines are very much about divisiveness. But what are some specific things, right, that we can do as a community?
Thanks. I think oftentimes the budget, people think about it as about numbers and things like that, and really what's important, I think, about the budget are the impact that they're having on families and kids and communities. And that and I think it's important to tell stories. I think, frankly, members of Congress, when they hear a story from a person like Elizabeth telling her story, that has a lot of impact. And so I think it's important to kind of stick with it, and continue to tell your story, how these programs help you, how cuts in funding hurt you, and what the real world impact is. I think I think and not to take no for an answer. I think, as Amber pointed out, a lot of times people say, well, we can't afford this. We're a very wealthy country, and our tax code can be reshaped easily in ways that make it not only more fair and more equitable, but also raise more revenue so that we can make important investments. I mean, I think we saw during the pandemic that if we make investments in programs, we can take people out of poverty, we can improve families and their well-being. And it's really a policy choice, and I think we just need to keep at it. People tell their stories, and so that really the policymakers understand how important these issues are.
Thank you, Joel. Amber?
Yeah, I just to echo that, and Adrian, you also mentioned it when handing off to Elizabeth. Just you've seen that happen too. It really does matter. I have seen it and witnessed it so much, that the power of people talking to legislators and to the governor and to federal legislators too. The thing is, it's easier to do the closer you get to your policymakers, but especially on a state and a local level, you can really directly advocate and help pass policy by showing up and by talking to your local elected officials. It really does matter. And telling those stories, Joel and I have all this data and we have all the research and we have all the numbers, and that's important, right? That's important. And the personal experiences and seeing what that looks like, the real world consequences of budget decisions have to be part of the discussion too. And so the real power is when you combine all those things. And we need to, right? We're all advocating for the same things. We're all aligned, but the systems that we're up against are decades and centuries of oppression, and they're still structured that way, right? And so it needs all that to change. That system requires all of our participation. It requires the numbers, it requires the advocacy, it requires the personal stories and conversations to change it. And so I think there really is hope in that, because we've seen it done. As Joel said, this is all a policy choice. It doesn't have to be this way, and we've seen it change in different areas. So I think there is a light there to look ahead to.
Great, thank you for that. Elizabeth, bring us home. Share with us a little bit. And you mentioned your policy, groups, parent groups there at your center at Gads Hill. Talk to us a little bit about what do you see about when parents come together, that really works, and that that isn't what we see in the media of this divisiveness, but it really is about seeing parents working together.
Yes, so it's called Parent Policy Committee. That's what we named it. Well, they named it, I should be saying. And it's awesome because they let us know of any rallies that are going to happen. I actually have not attended one yet. Like I said, I have my 2-year-old, and sometimes it's a little hard for me to leave them, but I know that the moms go. And whenever we want something to happen, they attend the rallies, they take them, they go with them, and our voice is heard. And our voices are heard, and we want, and that's all we want, our voice to be heard, our experiences, and not just as moms, as dads, as grandparents, as uncles. We invite the whole team to go and stand behind on what we want to be done. And it's great. They always help us out. Especially during the COVID, I remember that was when my other son started the program. They actually were helping us. Like, let's say that you needed household essentials, that you needed help with money, with food, with rent, with anything, the center would help us. And if we didn't get together, and if somebody didn't say, hey, you know what, can you guys help us with this? The organization is good. They got on it and they did what they needed to do, and scrambled here and scrambled there, and they helped families, which is awesome.
Thank you, Elizabeth. Thanks for sharing the importance of families connecting together. And I think the example that you gave as we kind of wrap up here is that you're connected, right, to the center, right? And they help, they support you, they provide that space, that backing, right? What Amber shared with New Mexico Voices, right? They're connected to other organizations and to families, right? And so, for our organizations, the essential work that we do day in, day out in the communities, that trust that we build with families, that's a platform that we have that we can use, right, to better understand the budget process and to engage families and to take them to share their stories with legislators and invite, it's not one way, right? Invite legislators and policymakers also to come to our centers and to see the work happen and to engage. So with that, just want to thank the panelists very much for being with us. Thank all the participants for your work every day with families. We put a link there in the chat. The follow-up to this, we'll send the folks, everyone here, the slides that the panelists presented, as well as the recording. And then we're going to rebroadcast this also on social media for those that weren't able to get registered and to see this. And, as I said, this is the kickoff to many webinars that we'll be hosting at the national level around advocacy, engaging our partners, and really elevating the Latino Infant Initiative Policy Plan that we launched with Unidos US. And we're just grateful, right, to have great partners like Joel and like Amber in your organizations. And we'll continue that work together. We'll reach out. There'll be advocacy opportunities with our partner organizations and with families, and we'll be sending out additional information on that. Thank you all very much. Have a wonderful rest of your day.